But we're fortunate again today to have Melissa Sanders with us. And Melissa, of course, is our medical policy analyst. And that's real quickly, just tell us again what that means.
I am very fortunate to be able to do research all day. I get to go to work and I get to look at new technologies, new drugs, all kinds of new information about medicine that's out there. So I research those things, and
those are the things after the research and all become part of the program for members like me that say these things can happen. And one of those big things, and that is always and a lot of people don't realize this, but when you get sick, it's important to have people who care.
Absolutely.
You have the doctor who cares, you have the nurse who cares, your family who cares. But I found out something. I've got a health insurance company that cares because I was taken care of so well. I mean, I sometimes I go nuts about this when I'm telling people.
That's great.
But anyway, so all that all has to do with preventive stuff, because it was the preventive that caught my prostate cancer early. It was being aware of things and using preventive. That's what caught it early. Thank goodness.
That's absolutely true, and we do care about our members, and we want our members to utilize the services that are out there for them.
Sure.
And because of the Patient Protection and Affordable Care Act, healthcare reform, patients now probably more than ever have the opportunity to take advantage of the preventative health screenings that are out there for them.
Well, let's talk about a couple of these screenings. Let's start with the stuff for the ladies.
Yes,
okay, we got mammograms, number
one. Absolutely. Mammograms are so important, and it's just important that women beginning at age 40 start having the mammogram every 1 to 2 years, and that's in combination with the breast self-exam and all the other things that are out there for them to do. But recent studies have shown us that 1 in 8 women could develop breast cancer in her lifetime. And 85% of those occur in women who have no history of breast cancer. Yeah,
that's the thing. A lot of it's in the genes, of course. But I know a young lady that developed breast cancer, and nobody in her family. There's 5 sisters.
Right.
And
it's actually a very small percentage. And so, we want. There is unfortunately no way to definitely predict it. So we want women. We encourage women to do that. Now. It's important.
At what age? You say it's 40?
40 years old.
Okay.
That's correct.
Okay. Okay, what else? What's something that we need to be looking for?
Again, along with the ladies, doing the cervical cancer screening.
That's
Pap smears,
important.
very important. Right. Cervical cancer is almost 100% preventable.
Really?
With
100%?
Pap smear tests. Yes, absolutely. The test looks for precancerous cells so that women can be screened out early and be monitored closer over the years should they show some precancerous
and those
development.
screenings are free.
That's correct.
Yeah.
That's correct. And women should start having those at age 21 and continue
every
year.
Really, 21?
At least 21. There may be some that need to start sooner, but definitely by age 21.
And let's talk about one more. Let's talk about stay on the ladies' side, if that's okay.
Yeah, well, absolutely. And this one applies to both men and women. Colorectal cancer screening.
Oh, sure.
I think it's so important. So important. It's
colonoscopies,
so easy. Colonoscopies are one of the ways to do that.
Are the colonoscopies in the?
They are included
really?
in the preventative services benefits. That is correct, and that's one of an arsenal of tools that we have to be able to screen.
I know a lot of people, especially men, are afraid of the colonoscopy.
Sure.
Because men are afraid of everything. Let's face it. When it comes to medicine, we don't want anything. And those are the hardest groups to get. But the colonoscopies, they put you out. You don't feel a thing. I mean,
that's right.
I mean, it's not like you literally do not feel a thing. Trust me.
Very comfortable. Given medications.
Yeah, and they give you this drug that. Let me tell you something. It's worth it.
Well, yeah, and the whole goal is to make it as easy as possible so that people do take advantage of these opportunities. Because on a personal story, my mother passed away from rectal cancer, and
so sorry.
she received her screenings, and screening caught hers early, and she went through treatment. But had she not, had that screening, she wouldn't have known. And you think, well, that's a kind of a gloom and doom story. Well, no, it's really not, because it gave her time. It gave her the time that she needed to do some things.
Well,
so it's very important to have those screenings.
And of course, your PSA, your prostate screening. Men,
absolutely.
I will tell you, you've got to get your prostate screening done. And I know that the blood test is simple. The other thing, I know how you feel, but guys, it takes less than 5 seconds, but believe me, it can save your life.
Absolutely.
And the prostate screening is included in the benefit program.
It is. There are all kinds of preventative
Yeah.
screenings out there. Those are some of the more popular ones that people hear about. They're all very, very important. And so I'd encourage people to talk to their providers to see which preventative services would benefit them
your
most.
general provider, we would call them family practice. Start there, then from there you can go to a specialist and so on and so forth.
Because there are recommendations for all age groups, male and female.
Right.
So, you know, when you're in your teens and 20s, there's a certain group of services, and as you age. And, you know, you were saying about men, men tend to not engage in healthcare services until something's wrong.
That's true.
And the sooner that they could start on the preventative screening path, you know, the sooner that hopefully they could avoid having to engage in major medical services later on.
And so guys, get your prostate checked. I'm telling you.
Very important.
Melissa, thanks again for being with us.
My
Great
pleasure.
information. Remember, you can go to Blue Cross website. It's on the screen. Get all the information you want. If you're a member, you even get more information.